When there is no clear role found in the Quran and Sunnah, ijtihad or qiyas is contemplated. Ijtihad is religious reasoning. In the later period, this consensus included the agreement of the learned scholars, the ulama, along with medical scientists like physicians, who are regarded as the most learned and most pious to render their opinion in the form of their collective agreement in healthcare decision making. It is the ijtihad that proves sacred law with its dynamism, including it to be relevant to the 21st century and its challenges. And it concerns, it all, uh, it all addresses the new technologies and the issues that are faced by the new technology. So, as I mentioned, the principles were there, but they were not named. The same principle of autonomy, the same principle of beneficence, the same principle of justice, and the same principle of non-maleficence. The same medical ethics, the values and principles that are upholded by the Western bioethics are used by Islamic bioethics as well. But the difference here is the applications is different here. So autonomy, the right to self-determination. From an Islamic medical ethical perspective, patients' autonomy, their ability to make decisions for themselves is very important. Every patient has the right to make decisions for themselves. But there is a caveat. It depends if they have the ability to make decisions for themselves. A patient with decision-making capacity should be the first one to be consulted about their health condition, including delivery of bad news. This is very important, especially in our culture. If a patient is admitted to a hospital with a very grave prognosis, but they have the decision-making capacity, they should be allowed to make decisions for themselves. The family can help, but it is the patient's right, and that is what Sharia wants us to do. In situation where the patient does not have decision-making capacity, then in those situations, we have a surrogacy hierarchy that's called surrogate decision-making. In addition to having a surrogate for decision-making, the patients are advised to tell their prior express capable wishes to their beloved one so that they can make decisions on their behalf. So this is the Illinois surrogation decision-making hierarchy. In case if a patient does not have a power of attorney of healthcare document, in case they haven't selected any family member as their power of attorney of healthcare agent. So I'm using the whole terminology power of attorney of healthcare agent because it is different from the financial agent. So whenever I get consulted, I'm told that we have a power of attorney document. I ask them, is it a financial power of attorney or a healthcare power of attorney? Because what I am concerned is the healthcare power of attorney. So if somebody has not chosen their healthcare power of attorney, and God forbid they lose their ability to make decisions for themselves, then we are stuck. But in Illinois, we are in good hands. We have this surrogacy hierarchy. So legal guardian of the person is selected by the court. If there is no legal guardian, spouse or civil union partner, adult son or daughter, parent of the patient, adult brother or sister, adult grandchild, if none of the family members are present, or if the patient is strange. The good thing in Illinois is that you can choose your friend to be your surrogate decision maker. But for them, it is very important that you sign a document, or the friend sign a document. It's called closed friend affidavit. If none is available, but the patient has a power of attorney for state, that can be used as well. Disclosure of medical information. This is very important, especially in our community. As I mentioned, patients have the right to know about their healthcare condition. All good, all bad information. But they have equally the right not to know or to delegate someone to be their decision maker. In our families, in our communities, families often are closely involved in clinical decision making. And if a patient does not have the mental ability to make the decisions, often a family member helps their family with necessary decision. At certain times, family may request clinicians not to share certain information with the patient. So if a patient has decision-making capacity and the family is saying, please don't share this diagnosis or this prognosis or this stress result, we have an obligation to share with the patient. But first we have to ask the patient, we have a news for you. We need to give you the news. How much you want us to give you? How much information you want us to give you? So here what we are doing, we are respecting patients' decision-making capacity, their autonomy, their self-governance, and respecting cultural, restrictions in those situations. If a patient says, no, I don't want to know anything about it, talk to my son, he will make the decision, or talk to my wife, she will make the decision. So what we have done over here, we have done our due diligence, we fulfilled our obligation to respect patient autonomy, and we are respecting patients' cultural boundaries as well. So Islamic Code of Medical Ethics states that the doctor shall comply with the patient's rights to know their illness. The doctor's particular way of answering should, however, be tailored to the patient in question. That means don't use medical jargons. Patient will not understand that. It's the doctor's duty to thoroughly study the psychological acumen of the patient. They shall never fall short of suitable vocabulary if the situation warrants the deletion of frightening nomenclature or coinage of new names, expression, or description. Summary of that is like, first, know your patient. Give them the information in their language, not in medical jargons, at their pace and how much they want to know. In West, we say it is our duty to tell the patient all the information. We have to just abide that. Should not be it's an important point to disclose the medical information, but we have to practice cultural humility as well. Beneficence, do good. It's an act of mercy, kindness, and charity. Allah Ta'ala says in Surah Az-Zalzala, verse 7 to 8, whoever does an atom weight of good will see it, and whoever does an atom weight of evil will see it. Justice, treating fairly. Allah says in Surah Mumtahana, verse 8, Allah does not forbid you to be kind, and verily, Allah loves those who are equitable. Obligation of justice in Islamic bioethics are subdivided into three categories. Fair distribution of scarce resources, like we saw in COVID. If a patient needs ventilator, they will get the ventilator. Doesn't mean if they are brown or black or Muslim or non-Muslim, rich or poor. Equitable justice, respect of people's right. Everybody is entitled to healthcare, regardless of any kind of discrimination. Respect for morally acceptable laws. Islam asks us to follow the laws of the land. We should not be quoting, oh, we are from Pakistan. In Pakistan, this happens like this, so we should be doing what happens in Pakistan. Over here, no. Follow the law of the land. Non-maleficence. This is a very, very important principle in medical ethics and in Islamic medical ethics as well. In Islamic jurisprudence, avoiding harm takes precedence over bringing good. All that is harmful is prohibited in Sharia. Obligation of preventing harm do not just relate to obligation not to harm another, but also includes obligation not to impose risk of harm, particularly with regards to treatments and non-treatment decisions. Those who have studied philosophy and ethics, they might know David Miller's harm principle. And that is what I was taught at University of Toronto. That is what everybody is taught in medical school. That is wrong. That is not David Miller principle. That is the principle of Prophet Muhammad sallallahu alaihi wasallam, which dated back 1500 years. So that is one point that when I started studying Islamic bioethics and I was doing my program at Hamad bin Khalifa University, and I came to know, oh, harm principle, this is David Miller's. No, this is Prophet Muhammad's. And we should be very vocal about this, that you cannot take Prophet Muhammad's harm principle and rename it. Prophet Muhammad, peace be upon him, said, doing harm and reciprocating harm is not allowed. Muslim jurists have been very mathematical in their judgment about this, such that the action must be taken if benefit outweigh harm by even 1%. So everything in medical ethics is about weighing risks and benefits. If the benefits are higher, okay. Little bit of harm, okay. But if the benefits are zero, no harm at all. Harm should be removed to what is possible. Harm should not be removed by another harm or by the same degree of harm. Just like we say, okay, let's take this harm, because then we will be able to get a lesser harm, or let take this lesser harm so that we will get a bigger benefit. So this kind of thing, you like bigger harm, lesser harm, these things are very important. Know that harm at any cost is not allowed. The most important thing is over here is like harm to an individual is tolerated in removing a public harm. Islam is not about individual person. It is not individuality like we have in West. The Western bioethics is all about individual, my rights, my autonomy. Islam is like, no, you have to think about the public. So when harm comes, if you're harming the population, the public, then they are allowed, the doctor is allowed to harm you, so to protect the public. Example is vaccination. Some people say, I don't want vaccination. I have this reaction, that reaction. I don't want to suffer the pain. But with your vaccination, the entire population can be saved. In those situations, you have to sacrifice yourself, take that harm so that you are removing the bigger harm. The first main principle of Islamic medicine is sanctity of human life, which derives from the glorious Quran. Allah says in Surah Ma'idah, verse 32, whoever saves a human life saves the life of the whole mankind. The second main principle is on the emphasis of seeking a cure. This derived from a saying of Prophet Muhammad in Sahih al-Bukhari, book 71, hadith 582. There is no disease that Allah has created, except that He also has created its treatment. Prophet Muhammad sallallahu alaihi wasallam in another narration is also reported to have said, seek treatment, O servant of Allah. For Allah the Exalted did not create a disease for which He did not create a treatment except aging. Thus, the default Islamic ruling on seeking medical treatment is that it is permissible and is conducive to preservation of human life, which is the main objective of Sharia. However, circumstances of illness may vary by patient, which necessitate further ruling. Per Islamic Fiqh Assembly, treatment is obligatory when it can significantly extend someone's life in a meaningful way. The most important word is meaningful way. It's not only about extension of someone's life. Treatment is prohibited when the burdens of treatment outweigh the anticipated benefits, causes severe pain, or violates human body integrity. Treatment is permissible or optional when it is neither obligatory nor prohibited. Even though treatments may be obligatory or may not be obligatory, the ethics of our duty to patient demands that the care is optimized in the line with patient wishes or those of surrogates. Okay, so now we'll come to end of life. Quality of life. So quality of life is the standard of happiness, health, and comfort experienced by an individual or a group. Preserving physiological life, that is, heart is working, your lungs are working, your kidneys are working, brain is not working. You are not cognitively alive. You cannot make decisions. You cannot process information. You cannot have emotions. That life is not a worthy goal in and of itself in Islam. The goal of care is to maximize the chances of an individual to regain their status of a morally accountable person. होश व हवास वाला इंसान जो कि अपने डिसीजंस ले सके, जो भी काम कर रहा है उसके लिए अकाउंटेबल हो सके. When the morally accountable person has lost the ability to morally accountable due to illness, and to preserve the cognitive function of an individual who has the potential of becoming a moral person in future, like children. So again, everything is focused on cognitive function. The cognitive function is based on your brain, the brain functioning. It's not like the brain is controlling or the sensation and everything. It's the higher functions of brain. Your thinking, your ability to reason, your ability to understand, your ability to do things that will make your akhirah better. So because Our life is a journey, a transitional phase to akhira, to the afterlife. So if you are able to participate and do things that will really matter at the end of life, then that life is worthy of living. There is a general positive outlook on death in Islam. It is seen as the will of Allah. To Muslim, illness is not seen as a wrath, but as a normal consequence in life. This is reflected in the powerful Quranic verse from Al-Baqarah, verse 156. To Allah we belong, and to Him is our return. Muslims believe that death is the departure of soul from the body by divine decree. I am emphasizing few words over here, so have a listen because then I will be relating these words later in my presentation. So death is the departure of the soul from the body by divine decree. Death marks the transition from one state of existence to the next and the beginning of the journey in the life hereafter, which is perpetual and infinite. Death is always remembered and announced by the name of Allah, and Muslim may accept the death of the loved one without going through classic stages of grief. Delaying natural death with futile or hopeless treatment is unacceptable in Islam. Prophet Muhammad mentioned, "None of you should wish for death because of a calamity befalling them. But if they have to wish for death, they should say, 'O Allah, keep me alive as long as life is better for me, and let me die if death is better for me.'" Terminally ill Muslim patients are permitted to have life-sustaining treatments withheld, like they were started and then stopped, or withdrawn, when physicians are certain about their inevitability of death, and when the treatment is not obligatory, or the treatment is not going to improve the quality of life, or the burdens of the treatments are higher than any benefits. However, it should be a collective decision acquired on the basis of informed consent after consultation with the patient's family and all individuals involved in providing care. So it is not like one physician say, "I don't think the treatment is going to help this patient, so we should withdraw the treatment." No, this is not an individual decision. It is a collective decision, and not only the decision of the physicians. Family members need to be involved in these decisions. I use informed consent. The informed consent means the physicians or the care team has given all the information to the family. They have told them, the prognosis, the risks and benefits associated with the treatment, and what their plan is. So they have given the information, and the family will consent us to withhold or withdraw the treatment. So it's a collective decision. It's not a unilateral decision. Advanced care planning, this is something I would like you all to listen to. Allah Almighty is very generous. He is the Lord. He knows everything. So He has clearly mentioned in Quran several times that every soul will face death. So this is something we already know. This is a question we already know. So when we know the question of our test paper, we should be preparing for that. We shouldn't be like, "Oh, we'll see when the test will come. We are going to get 100% marks in that." So preparation is very important. You will be surprised to know that 63% of US adults haven't completed an advanced directive. Among Muslims, the number is likely even greater, meaning most American Muslims will leave vital end-of-life decisions to healthcare providers they have never met, or the family members who may struggle with uncertainty over their wishes. And this is very common, I tell you. 90% of consults that I get is like, nobody knows the wishes of the family member. And now the family member does not have decision-making capacity. They are on the ventilator. Care team reach out to me. "Can we pull the plug? Do we know the wishes? No. Is there an advance directive? No. Family member know the wishes? No. Family member are saying, "We don't know what the patient wanted." So this is very important. The Quran and Sunnah point to a pragmatic approach to advancing age or declining health. This death is described as Allah's design, part and parcel of the life test, which can affect any stage of life. Allah says in Surah Al-Imran, verse 185, "Every soul shall taste death, and you will be paid in full only on the day of resurrection. Whoever is kept away from the fire and admitted to the garden will have triumphed. The present world is only an illusory pleasure. By being a sign of Allah's plan, such teachings alludes to aging or illness as worthy of our observation, thought, and planning, as well as being a general reminder for society as large. Death is unpredictable and can happen at any time, and as such, Muslims should always be prepared for their inevitable and for what is about to occur. Prophet Muhammad said, "The ones who remember death the most are the best in preparing for what is after it, and those are the wisest." It is very important, and please, 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 I say it is very important that you complete your POAHC document, Power of Attorney of Healthcare document. Choose the person who you want to make decisions for yourself whenever you are unable to make the decision. Please write your wishes, values, and preferences either in your advance directives, living will, POAC document. But please, please, please do that. So when you are unable to make your decisions, your values, your wishes, and preferences are respected. Pain control, a very contentious topic in Muslim community. In Islam, saving a life is encouraged and reducing suffering with analgesia is accepted. Even within this process, death is hastened. This rule is based on the central teaching that actions are to be judged by their intentions, not their outcomes. Some analgesics, some pain control medications are such that if you give them to a certain extent, they may cause loss of consciousness. And then the family will be like, "Oh, the patient has lost consciousness. What do you mean? We don't want this to happen. If you give this more to the patient will die." Over here, the intention is important. The intention is to control the pain. The intention is not to kill the patient. So Allah will see the intention. Allah will not see the outcome that the patient has died, so you killed the patient. So like killing a patient actively is haram. But we know that if you are trying to control pain and prevent suffering of the patient, and if the patient dies in that, you are not responsible. Permanent loss of consciousness, that is terminal sedation, that okay, we are giving them higher amount of morphine, the patient will be permanently sedated, they will not come out of sedation. That is not permissible in Islam. Why? Because of that, the patient loses the capacity to think, reason, and lose the capacity to perform willful actions. Again, because of our life is all about our ability to do things that will benefit in Akhirah. Life-sustaining treatments. Over the past decades, there have been a rapid medicalization of the dying process. Around the globe, you see most of the patients are dying in the hospital. In developed nations, most people die in medical facilities surrounded by machines and sterility, rather than in the confines of their home, surrounded by their loving relatives. Burgeoning technology and medical capacities have also contributed to this shift as access to healthcare facilities have increased, and now doctors are using novel methods and technologies to sustain critically sick individuals for a greater period of time. While this process has saved so many lives, it has also left many individuals puzzled as new forms of living and dying are established. Life-sustaining treatment is any treatment that serves to prolong life without reversing the underlying medical condition. So the underlying medical condition is not being reversed by life-sustaining treatment. It's just like sustaining heart function, sustaining lungs function, just sustaining it without having any meaningful outcome. It includes, but is not limited to, cardiopulmonary resuscitation, that's CPR, the resuscitation of your heart and your lungs, mechanical ventilation, putting a patient on a ventilator, dialysis, chemotherapy, and artificial nutrition and hydration. Withholding life-sustaining treatment is the decision not to make further life-sustaining therapeutic interventions, while withdrawing life-sustaining treatment is the removal of life-sustaining treatment, which has been started in an attempt to sustain life. Death is an inevitable part of life. Many people at the end of life experience unnecessary suffering and difficulty. Patients' families, close friends, and other relatives, they also face all these suffering and misery because they do not know what to do. As these life-sustaining treatments are modern advancement, there is no precedent in Islam on dealing with the issues related to them. These are all 21st century interventions, like all these inventions are very new. So, in these situations, how the Muslim jurist, ethicist, physician should solve this issue? How will Islamic scholars know what to do and what to do, not to do? Because, like, for giving a religious reasoning, they need a base. So, what is the base? Is there any guidance? Is there any guidance? What do you think? Yes. What's the guidance? Like, what's the guidance? Tell me the guidance in these situations. So, based off of what we derive from Wahi, like Quran and Sunnah, yeah, we use those principles and kind of apply them. What principle will you be using? Like all the ayat that you posted. Yeah. So Islam is not only a religion, it's a code of ethics, it's a code of life. So even though there is no precedent on life-sustaining treatment, withholding and withdrawing life-sustaining treatment, Rasulullah ﷺ did not leave us alone to deal with all these modern technologies. His principle of do no harm, the harm principle, that's why I was telling you, harm principle is the most important principle in medical ethics and in Islamic ethics that is basis of our all decision making. In withholding and withdrawing life-sustaining treatment, you're like, I don't know when to withhold this treatment. I don't know when to pull the plug. Use the harm principle. Use the harm principle when it says do no harm. Remove the harm. Do no harm, even if it is 1%. So when you think of harm, the patient is having by keeping them alive, like physiologically alive by being on the ventilator, the pain and suffering, you'll be like, this is significant harm. We should not be doing that if the patient is unable to recover and have a meaningful life. So yeah, that is what it is. So the harm principle, even though we don't have specific narrations, but there are principles on which we can base our decisions in Islamic medical ethics. So Muslim jurists differentiate between two categories of life-sustaining treatment. Life support like CPR and mechanical ventilation, and artificial nutrition, hydration, pain control, and antibiotics. The distinction between the two categories, the life support and artificial nutrition and hydration, exists because of our duties and obligation to treat patients related to the outcome of certainty of saving life. Artificial nutrition and hydration means giving nutrition by NG tube with a PEG tube, giving TPN, the total parenteral nutrition, via IV line. So these are artificial nutrition and hydration. IV fluid also come in artificial nutrition and hydration. So it is critical to sustain life and thus obligatory, whereas this is not always the case with life support, like CPR and mechanical ventilation. In Islam, medical treatment is encouraged and is promoted as an established practice of Prophet Muhammad ﷺ, and is not something that is contrary to trust in God's decree. Most of the time in our community, we see people saying that Allah Malik hai, that's fine. No need to get all these things. It's the normal process. This is the normal process of death. Allah, we should have trust in Allah. We should also remember, Allah has said, tie your camel and then trust me. Do your best and then trust me. And Allah has said multiple times that I will not change the condition of a nation unless and until they will try. The same application, same rule apply over here at the end of life. So we are not talking about life-sustaining treatment like CPR and mechanical ventilation, which is prolonging the life. Here we are talking about providing artificial nutrition and hydration so that the patient does not suffer. Let's talk more about withholding and withdrawing. An Islamic ethical legal framework for withholding and withdrawing life-sustaining treatment is not based on futility of treatment. Futility means uselessness of the treatment, because that is only related to the physiological state. The objective of life-sustaining treatment is not to unduly prolong life of patient in this state, nor is something that the Sharia demands. Sharia demands that we rescue patients so that they can live to benefit their afterlife by leading a life worshipping Allah, following his and his Prophet Muhammad sallallahu alaihi wasallam's orders, which will make their life worthwhile and meaningful. In Islam, a meaningful life is that a patient is able to brought to a state of cognitive consciousness. What is cognitive consciousness? It is a state of awareness, hosho havas, where at the minimum they are able to make choices of their decision, अपने फैसले खुद कर सकें, ability to feel, महसूस कर सकें, and an ability to enjoy and interact with the world, बात कर सकें, अपने expressions कर सकें, अपने wishes and preferences बता सकें. Even if the cognitive function is diminished to a degree that the patient is not legally accountable in religion for his or her action, meaning that, okay, they do not have that much capacity that if they are doing something wrong, we will hold them legally accountable. We know that the patient is sick. This is a general understanding. So when somebody is sick, we know that that person is sick. So we do not expect them to be making very rational decisions. And if they are making any wrong decisions, we will hold them for their decision. They get this leeway that they are sick. The same application apply over here. If a patient is not able to recover with life support to achieve a worthwhile or meaningful life with certainty, a life that can benefit the patients hereafter, then it is not obligatory to continue the life-sustaining treatment. So this is just a small chart which can tell you like how, in what condition it is permitted to forego life-sustaining treatment. Brain death, I will be talking about brain death later. Burdens of the treatment significantly harm and violates body integrity, physiological deterioration with expected death within minutes to hours, expected death despite treatment within days to weeks, and again, burden of the illness of underlying condition. According to the 1981 Islamic Code of Medical Ethics, in the deference of life, the doctors are well advised to realize their limit and not transgress it. If it is significantly certain scientifically that the life cannot be restored, then it is futile to diligently keep on the vegetative state of the patient by heroic means of animation. Animation means ventilation, or preserve them by deep freezing or other artificial measures. It is the process of life that the doctor aims to maintain and not the process of dying. Life-sustaining treatments are not truly life-saving measures for a patient who are at the end of life with no chances of recovery. Therefore, withdrawing life-sustaining treatments such as CPR is not intentional homicide. This is a very, very big, general and firm concept that if we are not providing cardiopulmonary resuscitation, CPR to a patient at end of life, we are killing them. No, this is not a murder. This is not a homicide. We have to take into consideration all the aspects of the outcome of the CPR. In a patient who is dying, they are already very fragile. We know that they are not going to survive. There will be no return of circulation. But as a result of CPR, we will be breaking their bones, causing them more pain and suffering, and the patient may die during the process of CPR. So again, the harm and benefit. The harms are higher than any benefit you may have in resuscitating a patient who is at the end of life. If the treating physician finds a certain modality of treatment useless or going to increase the suffering of the patient, that modality of treatment should not be enforced from the start, because Prophet Muhammad has directed the followers of Islam not to do any harm. So you see the repetition, everything is based on do no harm, do no harm, do no harm. This is the rule of non-maleficence that is the cornerstone of Islamic medical ethics, and so is in the secular medical ethics. The intention must never be to hasten the death, only to abstain from overzealous treatment. So we are not fastening the process of death over here by not providing life-sustaining treatment. What we are doing is like we are not becoming a hero, controlling the life and death situation and taking those matters in our hand. Article 63 of the Islamic Code of Medical Ethics state that the treatment of patient can be terminated if a team of medical experts, at least 3, or a medical committee involved in the management of such patients are satisfied that the continuation of the treatment would be futile or useless. At my institution, in our policy, we have two medical experts. But if I get a Muslim patient, then I quote this article of Islamic Code of Medical Ethics, and most of the time I get three physicians to weigh on that. It further states that the treatment of a patient whose condition have been confirmed to be useless by the medical committee should not be commenced. So these are the fatwas about decisions of organization on withholding and withdrawing of medical care. I will send these slides and you will have a copy of everything for your record. So these fatwas are based on three things: no benefit in continuing therapies, diminished neurological state of the patient, and compounding harms from the continuing care. So these are again the three principles on which we can withhold and withdraw life-sustaining treatment. This is a simplified form or chart which says that as a patient or family member when it is permissible. So and are the chances of recovery to a conscious state probable? If there are more than 50%, then yes, treatment should be continued. If the chances are less, it is permissible to withdraw care. Do the treatment harms outweigh the benefits? If it is yes, then it is permissible to withdraw care. If it's not, like the benefits are higher than any harm, then the treatment should most likely be continued. But you see, in here, it is important to have the background information for additional consideration because things change all the time. Patient situations change all the time. At one stage, we will see, oh, the benefits are higher than the burdens. After one day, we'll see how the burdens are higher. The patient is at more risk because it's a dynamic process. So we have to consider all the information for further consideration. Nutrition and hydration can be best understood with our broader duty to feed the sick. Consuming food and drinks are natural essential acts and necessities of life and do not fall under the category of taking medicine and treatment. Islamic legal texts do refer to consumption of food and drink alongside discussion on obligatory treatment. It is never permissible to withdraw procedures designed to alleviate pain and promote comfort. If hydration and feeding is stopped, the patient does not die peacefully and comfortably. They suffer from dehydration and hunger. Additionally, if the sick patient does not want to eat, Prophet Muhammad ﷺ has commanded not to force them to eat. This is a very important point about nutrition and hydration. In our traditional Western culture, in palliative care, they usually stop patients' fluids and nutrition. They say that if a patient is on IV fluids, they cannot be transitioned to hospice because in hospice, they do not have, skilled personnel to deal with that. But in Islam, it is prohibited to stop a patient's nutrition and hydration. Hydration and feeding should continue at a rate that is medically acceptable. So you see the alignment between Western medicine and Islamic bioethics. Medically acceptable rate. And no attempt should be made to withhold nutrition and hydration. If the feeding tube is withdrawn, it should not be reinstated. If patients who are slowly deteriorating, one should maintain a minimal amount of hydration and nutrition, sometimes a trickle until the last moment of life. This is to address the thirst they will have at the end of life. जो प्यास होती है at the end of life पे, you're not giving them buckets of water, just giving them some ice chips or fluid or like few drops of fluid to keep their mouth moist. And I tell you, everybody is acceptable to that in our Western culture. I had several Muslim patients who asked for this. I requested this based on Islamic bioethical principle, and all the palliative care doctors were in agreement to provide that trickle of fluid at the end of life. Okay, very important point. When is a person considered dead in Islam? This is the question for the audience. When is a person considered dead in Islam? Or when is a person considered dead? Come on, youth, tell me.
There's no breathing, heart stops, and there's no brain function.
Yes. So brain function. So the traditional definition of death, stopping of breathing and heart, is applicable if the patient is dying at home. But most of our patients are not dying at home. They are in the hospital, in the ICU, stuck to the machine, breathing machine, ventilator, everything. So in those situations, it is very important to see if the brain is functioning. Because in Islam, death means the departure of soul from the body. Nowhere in Islamic text it will be said, Allah has said, stopping of heart is death, stopping of breathing or your lungs is death, is failure of all your organs is death. Islam says departure of the soul. What is soul? Soul is your ability to function, to think, to respond, to do willful action, so that you can, all those willful action can help you at the end of life, in your life hereafter. In Islam, as I mentioned, personhood, that's the mukallaf, is defined by a person who retains ability to do willful action. All cognitive functions are associated with brain. Therefore, if a person is declared brain dead, they can be considered as dead. The criteria of death does not violate any Islamic principle. Additionally, brain death is considered legal death in Illinois. So if you have a patient on the ventilator in an Illinois ICU and they say, the patient is dead after relevant investigations, that will be considered dead. This is the resolution of Council of Islamic Jurisprudence in Amman, where they say that the death is the total cessation of cardiac and respiratory function and the total cessation of all the cerebral functions. And experienced and specialized doctors have ruled that the such cessation is irreversible and the brain has started to disintegrate. In this case, it is permissible to take the person off resuscitation apparatus, even if the function of some organs, heart, are still artificially maintained. And these are the fatwas considering brain death as death. Additionally, IMANA, that's the Islamic Medical Association of North America, has also endorsed, the criteria of brain death as death. So if a physician has determined that after a standard examination, a person's cardiopulmonary function has come to a permanent stop, it is considered dead. Also, a specialist physician or physicians have determined that after standard examination, the function of brain, including brain stem, has come to a permanent stop. Even if some organs may continue to show activity, it is considered dead. Organ donation and transplantation. So Islam instructs all Muslims to save life. Organ donation and transplantation is allowed for the purpose of saving life. Organ donation is an act of charity, as we said, beneficence. That is what it is. Organ donation from a cadaver, like from a dead person, are not equivalent to mutilation of the dead body. उनकी बेहुरमती नहीं है इस किसी डेड बॉडी से, किसी मुर्दा से अगर आप ऑर्गन्स निकाल रहे हैं तो ये आप उसकी जो बॉडी की बेहुरमती नहीं कर रहे हैं. It is an act of charity, and this is not a disrespect that you will be doing to the dead body. So this is the statement of the Fiqh Councils of North America. The Fiqh Council agrees with many individual scholars and the National and International Fatwa Council in considering organ donation and transplantation to be Islamically permissible in principle. All fatwas that have allowed transplantation have allowed donation as well. Done with a good intention, organ donation may be regarded as a rewarded act of charity. But there are conditions for organ donation and transplantation. There has to be a need for the donation. There has to be clear benefit to the patient. You have taken the consent from the donor as well as the recipient. There should be no sale of the organ by any party. No financial incentive to the donor or their relative for giving organs, but a voluntary gift is be permitted. Like we have seen kidney sale. This is not permissible in Islam because they are selling the organ to get the money. No cost to the family of the donor for removing the organs. Any permanent harm to the donor must be avoided. This is applicable for live donors, living donor. You are not allowed to donate your vital organs, like your heart, your lungs, because you are going to die. And like this dying is actually suicide. So this is not allowed in Islam. Liver, you can donate for transplantation because liver regenerates and is not going to kill you. Transplant of reproductive organ is forbidden. Donation after death is only permitted when specifically mentioned in person's will or in the driver's license. So even for the dead person, you need to have their consent. This has to be mentioned in their will or on their driver license that they are organ donor. Nobody can just say the family member, oh, you can, yes, you can procure their organs. You have to ask, did the person give you the permission to do that? Doesn't mean if the person has died, the body becomes your property. No, it is still Allah's property. Unless the person has asked you to do, you cannot do that. Blood transfusion is permissible, so is platelet transfusion and plasma transfusion. Giving blood to or receiving blood from people of other faith is permissible because Islam is a way of life, it's a social construct. You have to save a life and you should be saving your life. Here, the faith does not come because Islam is all about humanity. So this is the report of Senior Ulama Commission of Saudi Arabia who approved the removal of organs and their permissibility. And these are the fatwas relating to organ transplantation. Okay, it is not imperative on a Muslim to seek remedy except in life-saving situation and where the illness is due to infection, for which treatment is available. The patient should be treated even against their will if they are going to infect other people. In Islamic jurisprudence, completely stopping nutrition and hydration is a clear case of murder. If you mention this to your physicians in the West, they will say, no, we have to stop it. So then you can tell them, give a trickle of water, give ice chips. That is not going to go down and cause massive destruction, but it will just keep their mouth moist. Seeking palliative care, that is end-of-life care, symptom management is permissible in Islam. Treating pain is encouraged. Use of pain medication, that is analgesia, is permissible even if they have side effect, as acts are judged on their intention, not by their outcomes. Stopping, withdrawing, or not starting, withholding certain types of management are allowed if the treating physicians find a certain modality of treatment non-beneficial or going to increase the suffering of the patient. Stopping certain measures that support life or not starting these measures, example, do not resuscitate, DNR, or do not intubate, do not put the tube down person's respiratory tract, are acceptable if decided by at least 3 competent specialist physicians. This medical decision should be fully explained to the family, but it remains a medical decision. Don't expect a family to make a medical decisions for you. They are not medical experts. Our job is to give them all the information and tell them what we are going to do, and then they gain their consent, seek their understanding and their cooperation. Active termination of patient's life, euthanasia, physician-assisted suicide is not permissible in Islam. Brain death is considered death in Islam. Organ donation and transplantation, blood, plasma donation is permissible in Islam and considered an act of charity. I conclude my talk with the dua of Hazrat Abu Bakr that, oh Allah, make the best part of my life the last part, the best deed the last deed, and the best day the day I meet you. Jazakallah khairan for listening to my talk, and please pardon me for my shortcomings, and I'm open to questions.
Thank you. I think we need to coordinate the questions. Yeah. Because Disha is here, or I'll do that. So if you have any questions, please raise your hand, and then we'll go to the right person. Because I think time has run out. So we'll take the mic, and Disha can help in this.
Assalamu alaikum, and thank you for a very informative lecture and talk on this difficult subject. And I saw that you had detailed everything, but can you comment on artificial fertilization?
Artificial fertilization, this is still a topic on which our scholars and ethicists are working on. So with artificial fertilization, the permissible act is as long as the egg and sperm are from a married couple, they can have IVF and IUI. But if the egg and sperm are not from a married couple, then that is not permissible in Islam. So is the surrogacy, so like implantation and then letting another woman go through the stages of pregnancy. That is not permissible because it's not only about the egg and sperm, although it's about the bonding and the development of the relationship with the child. And Islam is just not about like do this, do this, do this. It's actually a social way of life, and having a bonding with your child is very important. So that on that Islam says no, that is prohibited. If and somebody is unable to conceive or unable to carry a child, accept as that Allah's will and adopt a child. Adoption is permissible in, like, again, the rules are different. Again, like, mahram, now mahram issues are there. So if there is mahram, there's no issue of mahram, and the child needs support, you can do that.
Because that Zaid bin Haris was adopted, and then there was a hukum to Rasulullah after so many years
Yes.
to declare that Islam does not allow adoption.
Yeah. So it's again this concept of mahram and mahram. So if it's like there will be an issue, like you are adopting somebody who is not from your relatives, like blood relatives, then it becomes forbidden. And then everybody has to just accept it as Allah's will. Yeah. Sure, go ahead. Again, with the freezing eggs, it's like if it is not going to cause any deformity in the child. So again, benefits and burdens. As long as it's like from a mother, you are preserving it to be used at a later stage, because at this moment you are busy in developing your career, studying or whatever. That is perfectly all right, as long as you know that there'll be no damage to you, no harm to you or the baby.
Can if I have a quick question.
Sure.
How much does age play a role in this decision making? Because if one has lived that long life and your organs are giving up anyway, but a youngster or somebody involved in accidents, emotionally, obviously, the family is very concerned and hoping that the patient will recover. So if does I didn't see any reference to age in your slides. Number one. Number two is in our culture, it used to be that people who are about to pass away to the next world, they were brought home for comfort. I remember my grandfather, but my mother had to stay in the hospital although she was suffering. So is there any law prohibiting discharge of patients to come back and die comfortably at home?
So yeah. So with the age, again, Islam is a very fair religion. And it's a way of life. So Islam will never say, oh, if you have crossed 70, you should not be getting, life-sustaining treatment. Or if you are young, 18 or 19, you should get all the support, even though the outcome is going to be bad. It depends on, everything is dependent on benefits and burdens. Like, is the treatment going to benefit you? Even at the age of 90, if the treatment is going to benefit the patient, if the patient has decision-making capacity at the age of 90 years, and something happened, and we have to put them in the ICU, and we know that they will recover, they should get all the treatment. If a 19-year-old involved in a road traffic accident with a very profound brain damage is in ICU, we know that the patient is not going to recover, the treatment should be withdrawn, because again, it's all about pain and suffering and harming the patient. The second part of the question, if we know that our loved one is at end of life, we should, and we know that nothing will reverse the treatment, like the course of the disease, we should bring them home so that they can pass away peacefully among their loved ones. In hospital, 90% of these patients are in ICU. You cannot visit them all the time. You cannot spend night with them. They are around machines. The nurse will throw you out. They'll be like, oh no, we have to do this, we have to do that. You cannot do that. You cannot stay here. But you know that the patient is at the end of life. They will pass in few days. So to transitioning them to palliative, to hospice, and then bringing them home either on home hospice or in the hospice care units is permissible in Islam. And it is medically permissible. And you will see in West, they will ask you to transition the patient to hospice when they will see that the patient is not going to recover or is at the end of life.
In your lecture, very
Jazakallah khair.
Question like you already answered. One question I have is, in my understanding, cardiopulmonary arrest is the death, even if the brain is functioning, because ultimately the brain will give up.
Yes.
On the other hand, if there is a massive stroke and there is not a brain damage, but heart and lungs are still functioning, person is not dead. So, if it is, the stroke is such that it has affected the vital centers, but the heart and lungs will also stop. But by definition, as long as heart and lungs are functioning, the brain is only damaged. Is another question, life sustaining. If this non-recovery situation,
Yep.
we should not keep him on the ventilator. So,
Yeah.
what is enlightenment?
Yeah, so in cases where there is a profound brain damage, so if the brain is damaged, the patient would not be able to sustain his vital functions without the machines. So if the brain is damaged profusely, the patient would be in ICU, on a ventilator, on a feeding tube, and all that. So these are artificial ways of prolonging life. I understand your question. So like the brain, the heart is functioning, the lungs are functioning, brain is not dead, but the functioning is very diminished. So that is called persistent, like a persistent vegetative state. It is the patient would be waking up and going back to sleep, normal cycles. The patient will be breathing, heart will be working, but the patient will not be able to have any cognitive function. In those situations, the time limit given is 2 months. So if a patient is in persistent vegetative state for 2 months and there is no sign of recovery, then the treatment should be withdrawn from the patient. So the patient is not considered as a brain dead person, but the treatment should not be continued because it is going to cause more harm than any good.
Sister, just to flip, so what constitutes a persistent vegetative state? Like, where's the line?
So the line is so the line is the, can you hear me? Okay. So the line is the time period, 2 months of no cognitive functioning, no understanding, no responding, no interactive, no meaningful interaction. But the patient is like sleeping and waking up. The heart is functioning, the brain is functioning. So it all based on the cognitive function of the patient.
So the reason I asked, I have an aunt who's in a situation like that. So she talks. Sometimes the stuff she talks about doesn't make sense. Sometimes it makes sense. So that's why I say, where do you draw the line? I mean, she's there, she's not there, in and out kind of thing.
Yeah. And for how long she has been in this situation?
Almost 3 years now.
3 years.
Is she on artificial because she's not?
She's at home.
She's at home.
That's fine. So here, over here, it is like we are prolonging life by artificial means. Here, she's at home, she's talking to you. That is fine. That's her normal process of disease. If we are sustaining their life on artificial means by like putting them on the ventilator, putting the feeding tube, most likely she will be on the feeding tube, but like putting the ventilator and stuck to the machines, and then we are prolonging, that is non-beneficial. Go ahead. चल नहीं रहा ये वो that's okay, that's fine, ठीक है बोलो. So in those conditions, they are born with it. So that's Allah's will. So nothing in the world has made those changes. So in those situations, we have to optimize how they can function, and fit in the society. So that's a different thing. Here, what we are talking about is like due to some medical conditions, this has happened. And because of that medical condition, we are prolonging their life by artificial means. Anywhere when it comes like artificially prolongation or artificially treating, then all these applications are applicable. Yes. Yes. Yeah. The same principles will apply. If they have a condition that is not treatable, or they come up with a condition where they are admitted into the ICU and they have these machines, same thing will apply for them. Disability will not be a source of discrimination for them to getting the treatment. Go ahead, Alvia. Welcome.
Assalamualaikum. Thank you so much, Dr. Fazal. This was phenomenal, really awesome lecture, and we're so blessed to have you in our community. One thing I would like to mention is, how do you recommend all of us go about updating or initiate the process of our power of attorney and our organ donation and all of that? How do you recommend that? I think it would be great to actually have a session where you help our community do
Yes.
that. Because I would say, out of all the patients you see at Cornell, what percent of your Muslim patients actually have it complete or even know what it is? So thank you so much.
At Condell, less than, no, it's not working. Yeah, less than 1%. They don't know what it is. And when I was in Minnesota doing my fellowship, and there is a huge Muslim community over there. And when we were talking about advanced directives, living will, and they were like, what is that? What do you mean by that? We don't make any advanced decisions, which is wrong, but Islam, because Islam asks you to make the decisions. So with organ donation, your driver license, when you go to renew your driver license, tell them you want to be an organ donor. First thing, when we are admitted in the ICU and are at terminal stages, they call the organ procurement department when they see your driver license, and then they are there before you are dead to, procure your organs. So that is the one thing. For living will thing, we can have a session about, writing your will and everything at IFN. But there, whenever we go to a hospital, our primary care physicians and internists, they always ask us to fill a healthcare power of attorney document. So that is a starting thing. Thank you.
We have time for one last question. If
Okay.
anyone has it. Okay, I'll just give it to Brother Wasim now for some final comments.
Okay, I'll just leave it there.
First of all, thank you, Dr. Fazal. It's a very difficult subject.
Yeah.
And many of us have gone through this difficult decision-making process. So I want to thank you, and you will have slides available.
Yes, I will.
Zishan has done an outstanding job in communication, and we will inshallah try to keep those slides in public discourse. I want to please mention that next week we have Dr. Zahir Sahlul will be speaking on Syria and Gaza. Dr. Sahlul is the founder of Met Global. You have heard of Met Global, which takes doctors to war-torn areas and they perform medical work there. So he is world famous. He has got multiple awards throughout the world, and I have had the privilege. We have the privilege of having him here. So please spread the word. It's a very, very relevant topic for today. So next week is an important topic. I hope everyone comes in. The following week will have some practical suggestions by a CPA on tax filing, what rates we get. So we are mixing and matching things on Sunday so that we can add to your knowledge base on different subjects. So please make this program successful. IFM management has done an outstanding job in facilitating the timing and space and everything else. And so please avail those opportunities. Thank you again, Dr. Fazal, and we appreciate you coming here. And we will see you next week, inshallah, all of you. Jazakallah khair. Assalamu alaikum.